Let's look at how you can perform scraping style IASTM with Ttool. So we're going to look at this on the calf and on the bottom of the foot. So if we look at the calf, in this example, I will use 3 different surfaces of Ttool for scraping. The wide bevel, the narrow bevel, and then the rim, which is this part around the circular side here. So kind of like no matter which way or which part I'm using, I will generally use the opposite side as a handle. So if I was going to be working on the calf here and I wanted to use the rim, I would generally hold it like this in my hand. So the stem will go between my index and my middle finger, and then you can perform scraping like this. Now, while you're doing this, you don't need to grip really hard. You can relax, and sometimes, depending on the body area, you can actually rest your fingers on the underside. So like you have this really nice contact, and so it makes it really easy. My hand is totally relaxed while I do this. So this is a great surface for scraping. You wouldn't generally think so because it doesn't look sharp, but it works really well. And in fact, it's many people's favorite surface to perform scraping style IASTM. And then what I can do is quickly switch to this narrow bevel. Now with the narrow bevel, there's generally 3 ways that you'll hold this. You can go the stem in between your fingers like this and sort of hold it like this. So then you could perform scraping like that. Or you may find that you want to hold it like this, and you kind of have your thumb resting there, and then you'll scrape this way. Or you can grab the circular side as a handle and then perform it this way. So you can do it as sort of a pull towards yourself, or you could also grab it like this and push. So those are generally the grips you'll take for the narrow bevel. And if you look at the wide bevel, generally probably what you'll do is put it between the stem between your index and middle finger, and then probably do some pulls like this. Now you can also do scraping style with the wide flat and the narrow flat. And you might actually find that you want to use these 90-degree angles. You can kind of push or pull, and that really depends on the patient or client's comfort and what exactly you're trying to do, the stimulus that you're trying to provide. You're probably not breaking up anything with a metal tool on the skin like this. So, it doesn't have to be sharp to be effective. In fact, these are purposefully not sharp so that you increase the patient's comfort, because we don't need to damage people's skin and we don't need to torture people to have effective soft tissue treatment work. Now, if I was going to do this on the bottom of the foot as another example, I'll use a little lotion or emollient and put this on the foot. And you could see I have a variety of options here. I could use the rim like this. A lot of people can't tolerate a sharp tool on the bottom of the foot, so this is really nice. And then you could easily and quickly switch to the narrow. And those are generally the ones you'd use on the bottom of the foot. You could use the wide, but I don't know if you would necessarily do that. It works pretty well in the arch, but generally you'll probably use the rim and the narrow bevel. So those are some of the ways that you can hold and use Ttool for scraping style IASTM soft tissue treatment.